Joining us now on the program, as she does each and every week, to talk about the latest in mental health topics all throughout our community and affecting us across the board, is Carrie Krawiec, a therapist at the Birmingham Maple Clinic. Carrie, thank you very much for being with us today.
Thank you for having me.
Yeah, glad to have you on. It's a really important topic as we're wrapping up the school year. And things are back to normal in the classroom from where they were pre-pandemic, but that doesn't necessarily mean that our kids are back to quote-unquote normal following the pandemic. This is National Children's Mental Health Acceptance Week, May 7th through the 13th, focusing on the importance of raising awareness for children's mental health, as well as treatment and a need for services and acceptance to reduce the stigma on these kids. So let's just begin with how the last few years, the COVID-19 pandemic in particular, has taken a toll on kids. Just how much have we seen an increase in reports of mental health struggles for kids as a result of the pandemic?
Sure. Parents and teachers and professionals are all seeing increase in certain disorders or diagnoses. It's yet to be determined if that is a result of just the circumstances or if there are some other causes or some reasons why we're seeing it more. Of course, there was the time when kids were out of school more and perhaps homeschooling or with their parents more. So behaviors that may have not been visible to parents were all of a sudden more visible. And then upon going back to school, just the circumstances of having sort of a lower stamina for the school day, not being able to sit still as long, or having even some anxiety, perhaps about infection or masking or whatever it may be. There are a lot of things we're seeing connected to the pandemic.
And that, of course, is going to have a massive impact on the kids now that they're back in the classroom. And already we have seen that have quite an impact on them reacclimating to social situations, to interacting, certainly the younger kids, in different classrooms each year with different teachers each year, and still recovering from what they experienced during the COVID-19 pandemic. So, in terms of these mental health issues that are arising, you touched on a few of them. What typically do we see from kids in terms of their struggles with mental health? Is it very similar to adults in terms of how wide ranging it is?
Sure. And of course, it changes at different ages and stages, what you see or what's a little more common, of course, and what's diagnosed. And there can even be, without careful consideration, misdiagnosis. Younger children may not necessarily look emotional in the way of, say, for example, crying. Maybe it'll look like irritability or acting out behaviors. So sometimes depression and anxiety can get called ADHD because it looks like a child that's restless or distracted when really they might be dealing with something emotional. And so, a really proper diagnosis from a psychologist can help tease out if it's one or the other or both. Of course, the statistics are something like by the age 14, 50% of children will have met the criteria, at least for a mental diagnosis at one point in their lives. And something like 20% of kids do have a mental health diagnosis. So that is in the same range of what we see in adults or nearby there. ADHD being one of the most common, anxiety disorders being, perhaps one nearby the top for children at younger ages.
And so, for parents, if they're noticing some of these changes, if they're being told of some of these changes by educators, by other people that are involved in their child's life and in their child's development, or even this is being discussed with them directly from their child, what should be those first steps that they take?
Sure. I mean, parents should know their children the best. And so that being said, parents would know, if there's something contextual happening, a move, a parental divorce, a change in the family's financial situation, or someone in the family is sick or doing poorly, parents would know, okay, maybe there's something in the context answering. Why are we seeing a change in thoughts, feelings, or behavior? And then you watch it, right? If something happens and then there's an adjustment period, after a few weeks or months, if things haven't sort of restored, then that is a sign of sort of mental unwellness, right? Because we're talking about mental health awareness. Mental health isn't the absence of feeling feelings, but it's part of restoring back to normalcy. So we should experience sadness, anger, anxiety, uncertainty, distraction, all of these things. But how quickly can we restore normalcy is really the evidence of our mental health fitness. And so if someone isn't seen to be restoring normalcy, isn't seen to be coping well with whatever the changes in their life may be, then that perhaps is a sign. that something needs to be investigated further. Like I said, changes in behavior, changes in sleep patterns, changes in eating, irritability, expressions of frustration, outbursts that seem to be too intense and don't make sense for the situation. Those would be things in younger children. Of course, difficulty separating from parents, nightmares during the night, a lot of wakefulness and hard to be soothed would also be a sign that parents would, of course, recognize that something's going on here. Seeing a psychologist or a therapist and getting a proper diagnosis, even talking first with your doctor, would be a helpful step to get a referral to the right direction.
And lastly, with about a minute left, Carrie, it's obviously important to get out in front of any of these mental health struggles you may be having at any age as soon as possible. For kids, I would imagine it's even that much more important because this is happening too during their development. So just how critical is it to get out ahead of these things as early as possible?
Well, absolutely. It affects self-esteem. It affects learning. It affects, so you're right. To address something early and sort of stay on top of it helps to reduce those effects, right, of the ways in which it might interfere with the grade school learning or the way it might interfere with friendship formation and things that are, of course, going to have effects longer term. So that would be certainly great advice is to pay attention early and often and address things as necessary.
If you need to get in contact with a professional, you can get in contact with the professionals at the Birmingham Maple Clinic by visiting birminghammaple.com. Carrie, thank you so much for joining us today.
All right. Thank you for having me.